Are you worried about your baldness? If your answer is yes, then hair transplant surgery is a reasonable option to consider. Hair transplant surgery is changing lives and helping people to regain their self-esteem and confidence with a younger look. All those people who have lost their hair can now reverse the process through hair transplant surgery. Dr. Kapil Agrawal is a cosmetic plastic surgeon. He provides all kinds of cosmetic surgeries, which includes hair transplantation, rhinoplasty, body reshaping surgery, breast surgery, liposuction, facelift, etc. He is well known for rhinoplasty, sculpting and body contouring skills. During hair transplant procedure, it is important to take care of the direction and angle of the hair. The density should be properly planned as well. During a hair transplant, the designing of the hairline is also very important. Be confident to choose Dr. Kapil as your surgeon to successfully deal with your hair restoration. What is hair transplantation? Hair transplantation is a procedure in which the hair follicles from the donor site are extracted and implanted in recipient site. What are the two main types of hair transplant surgery procedure? Two methods to remove the grafts containing hair follicles are follicular unit transplantation, follicular unit extraction. What is the surgical procedure for FUT? In FUT method, a strip of scalp is removed from the donor site, and then cut into individual units. The donor site is then closed using stitches. The dissecting of the individual follicular units is done by using microscopic techniques. The individual hair follicles are then implanted into the patient's balding area. How is FUE surgery performed? FUE method of hair transplantation involves taking the individual follicular units from the hair restoration patient's donor area, by cutting around it through a tiny specialized motorized machine, and removing them. The isolated follicular unit grafts are then removed with forceps, sorted and counted. The prepared follicular units are then implanted individually into the patient's balding areas. In FUE procedure, no stitches are involved and the donor area heals rapidly without any visible scars. What are the main benefits of FUE? No linear scar. The scars are barely visible in the donor area after the procedure. Less invasive. Small punches that are created with FUE take shorter period of time to heal. No sutures are required, as the punch sites are so small, they heal themselves. Graft selection. FUE allows the surgeon to cherry-pick grafts that are necessary for an optimal result. How long does it take to recover from a hair transplant? Most people are able to return to work 2 to 5 days after the operation. Within 2 to 3 weeks after surgery, the transplanted hair will fall out, but you should start to notice new growth within a few months. Most people will see new hair growth after 6 to 9 months. Who is a good candidate for hair transplant surgery? Hair loss type. The best candidates for hair transplants are those who suffered from male or female pattern baldness. This is a genetic condition that typically affects parts of the scalp, not all of it, which leaves patients with a good level of donor hair follicles. In contrast, unpatterned alopecia sufferers would not be recommended hair transplants, as they are poor hair donors, which most likely wouldn't lead to successful transplants, wasting your time and money. individuals who have realistic expectations. Men with realistic expectations and who understand that their hair loss might continue to progress, even if they are taking prescribed medication to stop the progression. Hair loss due to trauma. Men and women who have lost hair due to trauma or burns. Men and women who have lost hair due to other cosmetic procedures, such as facelifts. For hair transplantation and other cosmetic-related surgeries, you can consult Dr. Kapil. He is a consultant aesthetic plastic surgeon at various hospitals in Mumbai. To schedule appointments for consultations and surgical procedures, please call or SMS 9322-242-463. Email your queries to drkapilps@gmail.com or visit kapilsmakeover.com and visit www.clinicrhinoplasty.com.